Well, taking a look at your health on AM Extra, new COVID-19 research finds two leading signs that can predict a higher chance of death: respiratory rate and blood oxygen saturation.
Researchers at the University of Washington say anyone who gets a positive COVID-19 test can easily monitor those two signs at home. Joining us live to talk about it is a UW cardiovascular health researcher, Dr. Nona Sotoodehnia. Good morning to you.
Good morning. Delighted to be here.
Yeah, thanks for being here. So what are those two signs that people need to look out for?
So COVID-19 really affects the lungs. And in fact, one of the main reasons that people die when they die with COVID-19 is because of lung failure. So the two markers that we looked at were markers that look at lung health and lung dysfunction. One is, and they're both really simple. One is how fast you're breathing. So you count your breaths, for a full minute. And most people breathe less than 12, less than 16 breaths per minute. If you're noticing that you're breathing 22, 24 breaths a minute, it's time to call your doctor and get some advice from your doctor whether you need to go be seen in the emergency room. And similarly, the other marker is how much blood you have in your oxygen, the blood oxygen level. That's we call oxygen saturation, which can be measured by a really simple device, a pulse oximeter, which is a device that you put on your finger. And again, normal people have oxygen saturation levels greater than 95%. If you, the NIH advises that we, as physicians, we treat patients to keep their blood oxygen level greater than 92%. If your blood oxygen level is less than 92%, that's definitely time to seek urgent medical care if you have COVID-19.
Okay, I think most people are familiar with, the little things you can clip on your finger to kind of
Right.
track that blood oxygen level. How easy are those to get for home use? I've only ever used them in a doctor's office.
So they're available at most drugstores. There's a variety of them, but you can certainly find some for $20 or less. A couple things to note. One is not everyone who has COVID-19 needs to go out and buy one of these. It's important to remember the vast majority of people who have COVID do quite well, particularly if they're younger than 50, particularly if they're healthy. This is getting the blood oxygen level is particularly important for people who are older or who have other health conditions that really put them at risk, like high blood pressure, heart disease, diabetes. And what we found is obesity in particular. People who are obese have lower oxygen levels when they come to the hospital. So it's particularly important if you have a number of these risk factors, including obesity. But even if you don't have risk factors, it's really easy to just measure how many breaths you're breathing in a minute. And if you have COVID, you're not feeling great, but you're breathing rapidly, even if you're not old, it's time to call the doctor.
Okay, and can this be applied to other illnesses like the flu or bronchitis?
So that's a great question. COVID-19 is really unique, and it's unique because people come to the hospital with really low blood oxygen levels, and they're not short of breath. And that's not what we often see with other diseases. When your blood oxygen is low, you have air hunger. You're very short of breath. And so the CDC, WHO advised to come into the hospital if you have trouble breathing. And that's one of the problems with COVID-19 is you can have very low oxygen levels and have no difficulty breathing. That won't be your main problem, at least not initially. And that's what we saw when we studied patients with COVID-19 who came to Seattle and Chicago hospitals. Only 10% of them had any shortness of breath, even if they were despite being quite ill.
Yeah. Okay. All right. Well, Dr. Sotoodehnia with University of Washington, thanks so much for joining us this morning.
Thank you for having me.